Hey guys, I got mail the other day about my surgery. This brochure, Boston Children's Hospital, Department of Plastic and Oral Surgery. Um, it tells me when my date of surgery is, which is November 4th, and my pre-op, which is the 27th of this month. It's saying that I'm gonna stay one night in the hospital after my surgery, and it's saying on here that the appointments usually are an average between 2 and 2.5 hours. That's a long time. It's telling me about like what days they're open, their times that they're open, pre-op information, who can bring me to the appointment, telling me what time my pre-op is, which is at 9 that day, on the 27th. Then it gives me this little Aftercare. Before surgery, I should not take aspirin or ibuprofen containing products for 2 weeks prior to surgery. Many medications contain these compounds. These medications are blood thinners and may cause bleeding. It is safest to take Tylenol if needed. Avoid vitamin E, red wine, and garlic. Bandages, when I get them, it says I'll wake up with a bandage or a bra. This will stay in place for 4 to 7 days, and my doctor will remove this in the office during your follow-up appointments. My pain, you may have some pain and soreness after the surgery. Take your pain medication as prescribed and instructed by the doctor or nurse. Many people have nausea after surgery. This will pass within 24 to 48 hours, and pain medication can cause constipation. Be sure to drink enough water and eat foods with fiber. Bathing. During the first week after surgery, you will wear a bra at all times and not be able to get your chest wet. You may sit in the bath and be able to wash under your arms, but the garment cannot be removed. All your structures are dissolving. There are also paper tapes placed on all incisions. After your first post-operation visit with Dr. LeBeau, you may get these wet in the shower, and they should be pat dry after bathing, and the paper tapes will fall off in 2 to 3 weeks. That seems like a long time. Activity. Expect to take about 1 week off from work or school, which I will, like a week or two, depending on what my pain tolerance is. Any work or activity which requires strenuous activity or lifting greater than 10 pounds will have to be modified to reduce any stress on your incisions for at least 6 weeks. Vigorous exercise can be resumed in 6 to 8 weeks post-op. You may resume driving as soon as you are comfortable and after you have stopped prescription pain medication. This is usually around 1 week post, which is good because I got my permit today. When to call the doctor or nurse. When I have a fever, pain that is uncomfortable with pain medication, or bleeding through bandages and surgical bra. Follow-up. You will have a follow-up appointment with my doctor approximately 3 to 5 days after surgery. Bring 2 to 3 front-closing non-underwire sports bras in a variety of sizes to the office visit. You will be asked to wear only well-fitted sports bras for the first 6 weeks after surgery. When your bandages come off, your breasts will be swollen and bruised. Your breasts will resume a more natural shape over the next few months. If there are any questions or concerns, contact your doctor. And then it gives a bunch of contact information. It tells me my eating restrictions, which before the surgery, eating and drinking are not allowed for certain periods of time. If your child eats or drinks after this specified time, my surgery will be canceled. I'm not allowed to eat the midnight before the surgery. I have to stop eating solid foods, including candy, gum, mints, milk, thickened formulas, including commercial ones such as Enfamil AR. I'm children over the age of 12 months, which don't need to read that because I'm definitely over. 6 hours before surgery, only children under 12 months of age must stop drinking. 4 hours before surgery, they need to stop drinking breast milk. 2 hours before surgery, I need to stop drinking anything, and yeah. It's telling me about my illnesses. If your child develops a cough, fever, pneumonia, chest cold or has an asthma attack, you should contact your surgeon office as soon as possible. If your child has been exposed to measles, mumps, or chickenpox in the 21 days before surgery, please notify your doctors as soon as you become aware of the exposure. It's talking about my medication. No flu shots or immunization should be administered in the week prior to surgery. Ibuprofen, aspirin, codeine, and NSAIDs should be discontinued 2 weeks prior to surgery. However, if your child has been told by a physician to take aspirin for a medical condition, please speak with the physician and the surgeon before continuing it. It is safest to take Tylenol only if needed. It tells me where to check in. It's telling me that I need to arrive 90 minutes before my scheduled surgery. It's talking about consent. Surgery cannot take place unless consent forms are signed. A parent or legal guardian must sign consent forms for surgery for children under 18. If a parent age 18 or older is unable to give consent for treatment and or surgery, the legal guardian must sign. For example, those who with development delays are often unable to give information consent. If your child is 18 years or older and you're his or her legal guardian, please bring the legal documentation. It's telling me what to bring and other precautions. Your child must remove all surgery, including navel and other piercings, nail polish, acrylic nails, and contact lenses before coming to the hospital. Please avoid getting tattoos prior to surgery due to a high risk of infection. Definitely not going to get a tattoo before my surgery. And, yep, then it's telling me where to park. I'm really excited. I actually have a thing set up on my phone here telling me when my surgical consultation, which is the 27th, that's in 19 days, and my surgery is in 27 days, and I'm really excited. I seriously cannot wait. I've had so many people are asking me, like, oh, are you excited? Yeah, of course I am. And I'm hoping to find out what size I am or what size I can go down to on the 27th. I'll let you guys know. Bye.